Hello, everyone. I am your host, Sahar Hussein, and I'm back with the fourth episode of App Talk by AppVerticals, where we share industry insights with different industry leaders. Today, I have Faris Ghani, who is from healthcare industry. But in this episode, we are not just going to talk about healthcare. We are going to talk about a very specific area in healthcare, which is diabetic wound care, and a very overlooked topic, which is administrative and operational career opportunities in healthcare. So, without wasting time, let's meet Faris Ghani and start the podcast. Hi, Faris. How are you?
Good. How are you doing?
I'm doing great. Welcome to the podcast.
Thank you.
So, I am giving you my quick introduction. I am Sahar Hussain and I am doing social media management of AppVerticals since 1 year, and now I am hosting App Talk. Uh, I am quite extrovert. That's why I guess I'm here, and I love meeting people. I love communicating new people. So yeah, this is about myself. I love video playing. That is my hobby. And along with me, I have Faisal, my co-host. Faisal, can you introduce yourself, please?
Sure thing. My name is Syed Faisal, and I work as a technical lead over here at Code AppVerticals for the past 5 years.
Faris, can you please introduce yourself? Who is Faris? Your hobbies and all. Go ahead, please.
Absolutely, absolutely. So thank you very much for having me on your podcast. Very excited about talking about the healthcare industry and what we're doing here, both in the U.S. and the Middle East. Again, my name is Faris Ghani. I'm actually from U.S. I was from Cincinnati, Ohio, specifically. My background is in healthcare management. I've been doing this for over 22, 23 years. I've worked for multiple hospital systems in the U.S. That help with revenue cycle, physician management, practice management, how to run a hospital from an operation standpoint. And then a few years ago, I decided to take a project into the Middle East, which we'll talk about in more detail. I have multiple projects actually in the healthcare sector that we're working on here in the UAE and beyond. I'm also an adjunct professor at the University of Cincinnati, so I teach part-time. I teach global health, global business. So I teach one class a semester. So hobbies, yeah, I love sports of all kinds. So I'm a global sports fan. So I have, yeah,
Which
yeah.
sports you
So
like most?
most probably American football, your football, soccer, and I enjoy cricket as much as the next person, of course. Baseball, tennis. I've played baseball. I still play tennis. So I love all this.
Okay, so Faiz, I was going through your LinkedIn and you have been working in Africa and Middle East, right? In these two regions. So, what is the major difference you have seen in these two regions for healthcare?
Yeah, in healthcare. So when you go into Africa, of course, you've got many countries within Africa, right? So the one of the projects I was on was in Ghana, was setting up mobile clinics, health clinics that were specializing in primary care, so family practice, OB, and pediatrics. The biggest challenge in a market like Ghana is trying to establish all your financial resources, technologies, because you're talking about trying to reach out to people in remote villages. So how do you bring Western type healthcare in a mobile environment to people who live in remote villages in Ghana? So that was the big challenge there. Middle East, different set of challenges. They don't have the issue with technology or finances, but they do have the challenges with operational efficiencies, and how to properly, take care of patient post-op, pre-op. Just because they don't have their own system, right? They rely on, if you're talking about the UAE specifically, they rely on systems that come from the West. So trying to integrate the Western concept and the operational concept into the Middle East can be quite challenging.
Okay. So, different region-wise, we have different perceptions of people. What is the misconception you have noticed in Africa and like East and West, two both different regions? What is the misconception you have seen in people?
Specifically in Africa now, if we're speaking of? So if you're
Both
talking about
Africa and Middle East, both
Middle East,
misconception of people in both
sure.
regions.
Absolutely. So the misconception is that the clinicians are not very good. If you look at a doctor in Ghana, for example, or a doctor in the Middle East, the Western perception is, oh, they're just not very well trained. They don't have the clinical expertise that we do in America or even Europe. To a certain degree, depending on what specialty, there's some truth to it, but the big difference is the volume of patients that you see in African nations or the Middle East is 5 times, 8 times, 10 times more than what you see in the U.S. The entire United States population is 300 million, right? Just for comparison, Pakistan's population alone is 250 million, right? So you can't compare. It's like taking 250 million people and sticking them in the state of Texas. So the volume of patients that physicians see in third world environments like in Africa and then of course Middle East is just the volume of patients. So they don't think that the doctors have that expertise, but they do. They're much better than what the Western society.
Okay, so comparing the systems, is the biggest difference infrastructure, funding, or how care is delivered?
Between the East and West.
Yeah.
Yeah, it's the biggest difference is in the African region, and let's just speak specifically of Ghana because there's so many different countries in Africa. You're talking about good clinicians, but financial challenges and operational challenges. In the Middle East, you don't have the financial challenges. People have the money for the most part. There's other resources, but the challenges are the operational piece, right? Doctors, the mentality in the Middle East is that doctors run the hospitals. In the West, you have administrators that are highly trained to run the hospitals, right? They look at revenue cycle, they look at operational efficiencies, how to make the wait time in an emergency room shorter. So there's population health. So they really focus on the small details of how the operations of a hospital is run. In the Middle East, those details are not. You don't have hospital administrators trained to that level, so they rely on doctors to run the hospital. And doctors are good clinicians, but they're not good administrators.
Okay, so if I talk about specific practices on these several regions, do you think are some practices in these regions work better than the developed healthcare systems that we have already?
Yeah, absolutely. There's elements of the Middle East. One big area is the simple idea of payment, right? So when a patient comes in our clinic here in Dubai, for example, they come in, they pay for their service, and they leave. After they leave, they don't have to worry about any kind of remaining balance or bills or follow-ups from collection agencies. The insurance system in America, when a patient pays their copay and depending on what the cost of their encounter or a time with the doctor was, they will continue to get these bills from the billing companies that's what's part of the revenue cycle. So the way the insurances work, the reimbursement model works in the West is very complicated and very burdensome on the patient, where in the Middle East you don't see that. It's just you pay for the service and you leave and you're set. So very straightforward.
Okay, so Faris, let's talk about diabetic wound care, except healthcare. What is diabetic wound care for you? Like your specialization or what?
Yes, so diabetic wound is a patient is diagnosed with diabetes. Everybody knows about diabetes. It's a slow killer over time. When we first brought this service and started to research it in the Middle East, we found that doctors are talking about diabetes, how to manage your sugar levels, how to manage your basic wellness, right? But nobody really understood that if you don't address the issue with your diabetes properly, it can develop into a wound, which can look literally like a little cut on your foot. It's usually below the knee, near your foot or your leg, and that wound will get bigger if you don't properly address it. That's what diabetic wound is. It's a result, and if that wound gets too big, it will lead to amputation. And after amputation, the International Diabetes Foundation, as per their statistics and research, is that you will have maybe 2 to 4 years of life left after that amputation. So it's very critical that if you have diabetes, that you're paying attention to a potential wound.
And why it is a long-term challenge? Like why it is long-term challenge for patients?
Because patients simply don't have the education, number one.
Hmm.
And number two, they don't. Everyone thinks, oh, if I have cancer, this is serious, right? I need to go to the doctor, get all my cancer treatments, and women get their mammograms done. So there's a lot of the perception of cancer is that I need to take care of immediately. With diabetes, you just think, oh, let me just adjust my diet a little bit, do some wellness checks, and I'll be okay. But that's not necessarily true. Patients have to understand that if you have diabetes, you have to pay very special attention. Go to the doctor, get your foot and your leg checked, because what happens is diabetes can result in lack of circulation, right? Your blood stops, basically your blood stops circulating, and you develop gangrene and other different wound issues on your foot or leg, which then leads to the amputation. So people just don't have the knowledge, and they don't, and then we don't have the experts in place in this region until we came along to address that.
Okay, so do you think there are some mistakes they are doing if talk about diabetic wound cure?
It's not that they're making mistakes. It's just that they don't have the local market just didn't have the knowledge, right? So they would just so for example, if a patient comes in with a wound, they'll say, let's just clean it up, give you some antibiotics, put a bandage over it, and send you on your way, right? Nobody's going in there and properly removing the infection, then even covering it with skin substitutes, right? So we have different products that allow the wound to heal in a very, very proper manner. We want to eventually set up placenta banks because the skin substitutes are developed in a lab through placenta. So those resources are not here right now, and we want to bring those resources so patients can have access to the skin patches. They're basically natural skin patches that go on top of the wound to help heal it. So those are the types of elements that we want to bring for healing for the patients.
So, in terms of digital transformation, which part of the healthcare workflow do you think needs the most work upon? Is it going to be the patient onboarding, the billing, or internal coordinations?
Are you speaking about a specific region or just globally?
The Middle East or Africa?
Okay, so the Middle East and Africa, from a technology standpoint, they have the technology concepts in place. It's the implementation of that technology that they're trying to catch up on, right? The healthcare. For example, we have something in the wound world, diabetic wound. It's called a wound tracker, right? And that's to track patients once they leave our clinic. That how is your wound doing? Is it healing? Is it still infected? What's going on, right? So they have the money and they have the technology, but the issue is that the implementation of that technology has been the challenge. In the African nations, specifically the Ghana, yes, you're looking at the limited technology that's available there, financial resources. So that's what limits them. But specifically in the Middle East, it's more about how do we take it from we have the technology developed, but now we want to implement it, meaning that we want to get that technology approved at the ministry level. And a lot of them, if the ministry doesn't understand what the technology does, they take a long time to get that approved, right? So those are some of the challenges that we face technologically.
All right. And in terms of revenue cycles, do you think automations or software platform can realistically reduce errors and delays in the healthcare system?
They can, but those technologies for the revenue cycle have to be developed very, very carefully. You cannot just plug in because if you're talking about different CTP codes, CPT codes, all the different revenue, how the money is collected. When you have thousands of patients at a hospital, how do you collect that money? So I think the Middle East technologically will be much easier if you have AI-based technology. I think it will be a lot more effective because it's not as complicated. In the U.S., the billing and revenue cycle world is very, very complicated. So that's why it's still done very manually there.
All right. And in terms of speaking through AI, right, and AI diagnostics, do you think there is a difference between the disease in the US as opposed to diseases in the Middle East and Africa? And is there a role of AI to kind of like distinction between the user? Hey, if it's a user in the US asking for a diagnosis, it should give relevant information.
Yeah, it's. I think the U.S. is much simpler when you're talking about diseases because you don't see malaria, you don't see a lot of the complicated diseases that you see in the East. America is kind of a world of its own, right? So it's very contained. And if anybody has that potential issue and they're coming to the U.S., they'll catch them early and not even enter the country, right? When you're talking about the Middle East and African nations, there's more diseases, more, and there's less resources, especially in the African nations, to try to cut those diseases off, right? So those are the challenges outside of the U.S.
All right. And do you see a mobile-based healthcare solution playing a bigger role in regions where traditional infrastructure is limited?
Absolutely, it's still it's actually those mobile services. I know them. They're happening in Pakistan. They're in the Middle East. They're lagging a little bit because to get some of these approvals in the UAE, for example, are not that easy. Mobile clinics. It's not as critical in the Middle East either because it's Middle East. You're talking about very small countries and African nations. I think it's very critical to have mobile services in Ghana. That's one of the things that we were working on was how do we bring a mobile pediatrics unit to a remote part of the village. But then you're talking about powering up the electricity. Internet connection. So there's a lot of other complications that come with it, with the mobile, but with technology and the internet becoming so properly global now, I think you're going to see more and more, mobile solutions to healthcare in the near future.
All right. And do you think healthcare will become more app-driven, where patient interacts with system more than physical setups?
Absolutely. Depending on what specialty it is, of course, if you're talking about childbirth, OB, and things like that still is going to be hands on. But there's going to be certain specialties. Family practice already, internal medicine. You can see remote mobile clinics. Where doctors are doing everything through virtually. So yes, I think the general checkups are going to become more and more common virtually. They already are. But I think if you're talking about specialty and subspecialty and something that's more acute and needs more attention, then that still has to be done in person.
And what would you suggest a person who's using AI to kind of like figure out his diagnostic? Even in speaking of in terms of journal diagnostic, there are chances that AI can hallucinate and cause,
Right.
misdiagnosed an issue. What would you suggest a user to do in this kind of situations?
I suggest that patients still go see their doctor. My father was a doctor. He was trained in Pakistan, in Saudi Arabia, and England. And the one thing that he learned that was most important was until you touch a patient, there's no way you can make a proper diagnosis, right? And that's the way he was trained. That generation of doctors were trained like that. So that still upholds today, right? I mean, if I'm a patient, I don't want some virtual equipment or technology to tell me, and I'm a two-time cancer survivor, right? So I understand what health challenges are like, surviving cancer. So I want somebody who's gonna touch my body, feel my pains, and then be able to give a proper diagnosis.
All right.
Okay, so Faris, most people think in healthcare it's only about doctors, nurses, patients, but I was going through your LinkedIn and you have been worked deeply in administration and operational roles. Can you tell us about these roles, those who are in like behind the scenes role in
Absolutely.
healthcare?
Yes, absolutely. So I'll preface it by saying that the general thinking, especially in the East, Africa and on the East, is that the only person healing the patients is the doctor. And I can tell you by firsthand experience, my brother is also a healthcare administrator. I have a very large network of individuals who are in various areas of healthcare on the business side. Is that if you don't have, you need the doctors, right? But how are the doctors getting to the patients? How are the patients getting to the doctors? What technologies are they using? Is the EHR system working properly? Are patients waiting time in the waiting rooms working efficiently? Are they checking in and checking out okay? What does pre-op and post-op look like? All those procedures are managed and handled by administrators. They're mapped out by administrators working with the doctors, of course, because I'm not a clinical expert. That's not my background. And I'm not going to pretend to be. But I understand the business side and I understand the operational side of running a hospital or running a clinic. And really, and for example, so if a patient comes in and they have to wait in the waiting room and they're a back pain patient for 45 minutes, for 1.5 hours, then their pain is only going to get worse. So you're giving them very poor service. Their health is deteriorating because someone did not come up with a process that's going to allow them to come into the waiting room, check in, and then see the doctor within 10, 15 minutes, right? So those types of elements on the operations side are very crucial to making sure that you have the patient taken care of properly. And that goes all the way down to vendor management, to making sure the surgical equipment and the larger equipment like the MRIs and CT scans, they're all up to date. They're configured properly, because ultimately the patient will pay for it if it's not done properly. So that's all there's so many other areas that we can talk about, but I wanted to just give a few examples and a general idea.
So, do you think healthcare administration is becoming more important than healthcare systems getting more complicated nowadays?
It is.
AI and smart systems.
Yes. Healthcare administration is becoming more critical. And up till 5, 10 years ago, 15 years ago, I didn't hear of too many healthcare administrators in the Middle East. Now they're hiring healthcare administrators from the West. I'm one of them, right? I came over to the Middle East to do that. Some of the Southeast Asian countries still lack in that. Doctors still run the hospitals. If you look at markets like India, Pakistan, Bangladesh, doctors are still running the hospitals. But Middle East, they're seeing more and more experts on the operation side, CEOs with healthcare management expertise and backgrounds running the hospitals. So that's only going to grow. I think one area that they truly invest in is, instead of hiring always people from the West, is establish a degree, a certificate, a school of healthcare administrators in this part of the world. So that way they can create their own talent and develop them.
So, talking about specialized clinic like a diabetic wound, maybe. So, are these becoming very common globally right now?
Globally, they're not. They're in the U.S. They've become more common, of course, but if you're talking about globally, no, people are not aware of, they don't even know what a diabetic wound specialist is, right? And I'll give you a very specific example why that is. The diabetic wound specialist is a podiatrist, right? It's in America, you go to podiatry school, you do a residency, you do fellowships, you do all kinds of training to become a podiatrist. Podiatrist in the East can be as little as a 1-year, 2-year certification, very basic training. There's no real advanced training for the diabetic wound treatments. That's why when you hire somebody from this part of the world, the East, Middle East, that podiatrist does not have the level of expertise that a podiatrist from the West does, because they haven't gone through the proper education and training, which exactly shows you why some of the products that we're launching in this part of the world did not exist until we came. So you can see the trend, right? When you don't have the training and expertise, that simply does not, translate to the experts being in this part of the world.
Amazing. So, moving forward to my favorite round, rapid fire round, for which I have some questions, some statements, some myths about healthcare or maybe diabetic, and you just have to give short answers for that.
Sure.
Have you heard about rapid fire round previously?
On Bollywood shows, yes. Not in the healthcare world.
Okay. But now we are going to do for healthcare roles, okay?
Of course.
Okay, so revenue cycle management is still a major leakage point.
Absolutely it is, yes.
Preventive care is still weaker than reactive care globally.
Yes, absolutely, 100%.
Healthcare needs better system integration more than more apps.
Yes, it does.
Compliance frameworks slow down innovation in many cases.
It does, yes, I agree with that.
Digital transformation in healthcare is still in early stages.
Yes, very early stages. A lot of development left in that.
Healthcare administration is the backbone of the system.
Yes, it is.
Speed in healthcare systems often compromises accuracy.
100% true.
AI in healthcare is still more potential than reality.
Correct. I agree.
Most underrated healthcare role.
Healthcare administrator, manager.
Diabetic wound cure preventable or underestimated.
Underestimated.
Healthcare administration backbone or support function.
Backbone.
Okay. So, since we are moving towards the closing of the podcast, I have a question for someone who is looking, understand, and want to understand that healthcare beyond a clinical side. What is the first thing they should learn about how the systems actually works?
My suggestion is that they work in a smaller clinical setting with the doctor in multiple regions, not just East or not just America. A very good training ground is the US because you see all kinds of healthcare management challenges. And you get the proper training, revenue cycle, operations, recruitment, I mean, you name it. There's all kinds of challenges. So I would recommend, and don't start with a big hospital because you won't. That individual will not learn the small things. They'll learn high level things. So it's very important to work in a smaller kind of clinical setting, small clinical setting with one or two doctors to understand the day in day out of how a clinic runs.
So, that's it from my side for questions. Faisal, do you have any question?
No, I think that's all from my side as well.
So, thank you so much, Faris, for
Yep.
being in the podcast. It will be very helpful for all the healthcare people looking us.
Great. No, thank you so much. I really enjoyed it. Thanks for all the great questions, and hopefully we can do another session in the future.
Sure, sure, we will do it.
Thank you so much for having being with us on the first podcast. It was really nice talking to you, and see you shortly.
All right.
Thank you.
Take care. Take care, guys.
Thank you. Bye.
Okay. Bye.
Bye.